I was having some issues with my right back bottom molar. Number 31 is what we've all come to refer to it as since I've been treated. But I had to have a crown put on that tooth, and it always seemed too tall, too big. I had a lot of inflammation in the gum area around that tooth. So the plan was to remove the tooth, do bone graft, and then after I had healed from the infection, then they would plan on putting the post implant in. He did the biopsy at the time of the post implant, and the biopsy came back with cancer cells present. The plasmacytoma to my right mandible was a very rare cancer. It only affects about 1% of the cancer patients. So it was unreal, and there's no cancer or history of cancer in my family. And so to get this diagnosis, it was a shock to my family and me. After speaking to the traditional radiation oncologist and medical oncologist and hearing the recommendations by them, I wanted to get a second opinion. So I went to the Proton Center and spoke with Dr. Alan Meek. I have to say, right now, he's my hero. He spent almost 2 hours with me going over the photon radiation versus proton radiation, the advantages, and I left there without a doubt. This is the place for me. This is where I will seek treatment. I had the most compassionate, caring, kind radiation technicians that took care of me, put me in place every day, brought me warm blankets, anything to keep me comfortable. I mean, when you're going through radiation, I'm sure it's hard or difficult for anyone to keep a smile on their face. But the way I looked at it, these people are part of who's saving my life. Well, looking back over the entire situation, the entire year, it was just like a complete different world than what I was explained to would happen to me with the traditional radiation. No, I didn't lose any of my vision. I didn't lose any hearing. And as far as my mouth, I was able to eat the entire time during treatment. And I know proton therapy is not for every cancer patient, but I want it to be, I want to tell the world. I simply want the word out to every medical organization that proton therapy is available. It is less side effects. It is healing. It works. I'm proof.